Is it unusual to have knee pain 2 years after knee replacement surgery? Chronic knee pain after surgery is common. Now, you're expected to be in pain during the first months right after surgery, but after 1 to 2 years from surgery, you should be done with all the healing and you should be feeling used to your knee at this point. If you continue to have knee pain 1 to 2 years after your surgery, then there's still a problem. It's estimated that up to 20 to 25% of people that have had a knee replacement report it being a failure within a year or two after having knee replacement surgery. And that percentage increases as the years go by since having their surgery. Now, often when these people go back to their surgeon because of the chronic pain they're having a year or two after surgery, the surgeon will tell them that everything's normal. They'll do an x-ray, possibly an MRI, and the surgeon often says everything on the surgery looks just fine. Not sure where you're having pain. They might chalk it up to having nerve pain because they do have to cut through nerves in order to perform a knee replacement surgery, or they might say that you need to continue to do physical therapy and get stronger. However, some people also feel that the physical therapy exercises are no longer benefiting them. They're either not getting any better at all or possibly even causing some pain. What you need to know is that surgeons and most physical therapists can't see things called muscle imbalances, also known as muscle compensations. This is often the reason for continued pain after having a knee replacement. So what should you do about chronic knee pain after having a knee replacement surgery? Well, the first thing is to look at correcting the muscle imbalances. This often means that you need to get stronger glute muscles and stronger foot muscles. Since you've already had a knee replacement, then you technically can't get knee arthritis in your knee joint again, but the other tissues around your knee joint, like the tendons, the ligaments, muscles, nerves, bursa, all of those tissues can become painful, and the solution to taking pressure off those tissues would be to get stronger glute muscles and stronger foot muscles. I talk extensively about correcting these muscle imbalances that cause chronic knee pain in those that have had a knee replacement surgery here on this channel. I put all the videos on a playlist for you. I have linked it in the description below. It's called the Knee Replacement Help Playlist. And I've also made a comprehensive online program called the Failed Knee Replacement Recovery Program, which is also linked down the playlist, and you can check that out for more details. If this video was helpful for you, please like and subscribe to our channel. Also hit our notification bell so that you don't miss out on any of our helpful videos. Thanks so much for watching. I'll see you in the next video. Bye-bye.